thank you so much, Ali. Okay, so what I'm doing right now, I'm now in the butt, hip, thigh, and leg area. So, like roughly, I'll do the quadriceps and the butt, hip, and muscles. So the quadriceps will be the anterior thigh muscles, and those are the ones we saw. Yesterday, was it the day before yesterday when we were doing the sciatic nerve and stuff like that? Do you see how I'm removing this connective tissue? And over here, you will have the sartorius, which kind of covers a little bit of the rectus femoris, which is the first of the quadriceps, okay, in the anterior part of the thigh. So you have to be careful here when you are, dissecting and separating this sartorius. Okay, so the sartorius kind of comes like this on the actual human, and because you don't want to cut with it the rectus femoris, which is going to be on the bottom. But first of all, I'm going to kind of start here. You see how you could see this muscle here? That's the quadrifemoralis dash dash dash. So I'm going to follow that, and then part of the hamstring that I'm going to work on just for now would be this biceps femoris. Okay, and you know it's got two heads. That's why it's called biceps femoris. So the biceps femoris is to the thigh what the biceps brachii is to the arm. You understand? Both have two heads, one short, one long. So this one, the short head is supplied by the common fibula, correct? From yesterday or whatever. And then that one is supplied by the tibial nerve, the long head. Okay? And today we're going to see the sciatic nerve right here. You see what I'm saying? Aren't you excited? You know what I'm saying? So I'm removing this connective tissue, and like that. So I'm going to work on this line here. And over here, because of this tensor muscle, and there's a lot of fascia here for the tensor fascia lata, so it's going to be a lot of fascia, so you're going to be careful that you're not cutting through the muscle. So, okay, so that's where I start, and then I'm going to go to my quadriceps. Do you see what I'm saying, my good friends? You see my cobwebs? My video is on. See, so I like to do this. So when I do this, and then I can see my connective tissue, then in that case, I'm going to start to cut away very slowly, very in small bits. You understand? Do you see now? When I do this, I can see, oh my God, the connective tissue is there, and then I am cutting, being like that, cutting. And we're going to see the sciatic nerve today, my good friend. If you see how big it is in the cat, so you can imagine how big it is in the human. Okay, we're like a few times bigger than this cat. You see what I'm saying? 10 times bigger. Okay, so ours is going to be even bigger. You can't miss it a mile away. You understand? Here we go. We got that. It's going to be a lot of muscles that we're going to sort of reveal here. And I cut through my tensor fascia lata just a little bit. Okay, I do that. So we're going to work on this one. You see, it's going to be over here. Do you see my little finger over there? So this is going to be the semitendinosus, and we'll work on that a little later, but I'm just showing it to you because it's right there, you know what I'm saying? So I can't ignore it. So I'm going to work over here, work up here, and then this here, the quadrifemoralis dash dash dash, partially covers the gluteus maximus. So you have to nicely peel it off of the glutes, the gluteus maximus, okay? See, but I have to follow this line here. You see what I'm saying? And then I'll follow this line. See this line here? I can see that. Okay, so I have to make these small cuts. So here, there's that. Okay, see here? See, there's that. So that I can expose the do you see what I'm saying? Over here, you see? Okay, I can expose the quadrifemoralis dash dash dash. So I might need to do this. Get my sharp edge again. I use it sparingly. I don't want to, damage my muscle here. See what I'm saying? Then I can do this. I can do nice small cut. cutting these quadrifemoralis off of the gluteus maximus. Gluteus maximus is the biggest butt muscle. There's three of them: gluteus maximus, and then gluteus medius here, gluteus maximus there, and then gluteus medius here, and then gluteus minimus, the smallest one. Okay, my good friends, you see what I'm saying? I peel it off here, I peel it off, bing, bang, bing, bang, bing, bang, bing, and then you could already start to see some of the branches that go into the sciatic nerve. Oh my God! You see the phone? You dropped it. You dropped it. There you go. Bing. And then I'm gonna cut it off of here. And then you can see the vastus lateralis is covered by the fascia from the tensor fascia lata. So this is the tensor fascia lata. Okay, so there's going to be like a ton of muscles here. We just really haven't done a lot, but we are revealing a lot of muscles. And this is my quadrifemoralis dash dash dash. And as you can see, it's going over here. And I was separating it from the biceps femoris. Okay, and then here. So I'm going to work on this line. Do you see this line here? It's kind of faint, but it's right there. You know what I'm saying? So I work on it. So I'm going to peel now the quadrifemoralis off of the gluteus maximus, which is this. Okay? So I'm going to do that. So I use my sharp end a little bit here to just separate out here like that. Do you see what I did? I use it to pick on it like that, and then I quickly got away from it, because then if I do that, so then I can do this. Do you see now my connective tissue? You see what I'm saying? And then I go back to my blunt end towards the cat. And then I cut. Bing. And then I'm cutting. Bing. Do you see what I'm saying? So I'm peeling the quadrifemoralis dash 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 off of the gluteus maximus. The big butt muscle. Okay? The biggest. You see what I'm saying? There you go, my good friends. Did you see that it was very faintly separated, and if I had not been careful, I was going to cut through the whole thing, and then that would not have been bueno. You know what I'm saying? So there's that. So there's the quadrifemoralis dash dash dash, and the sciatic nerve is going to come like right there. There's the sciatic nerve, my good friend. Do you see it? Look how big it is. Sciatic nerve. So the human one is going to be humongous. You won't miss it a mile away, okay? This is excellent. And we said just superior to the popliteal fossa, which is here. It's going to split into the common fibula, which kind of comes to us laterally. And then the tibial nerve, which is going to go to the front and innervate the anterior leg muscles. Okay, my good friends, do you see that, my good friends? So we are styling here right now. Bing, bang, bing, bang, bing. See, all this is gluteus maximus. Do you see it? Do you see our cobwebs? Which means the separation is good. Do you see that? So there's that. So this is quadrifemoralis dash dash dash. No, this is the over here. All this is the gluteus maximus, and you can see the line here separating the gluteus medius, which is kind of flat. We don't see the gluteus minimus here, okay, my good friends, but we do see the sciatic nerve. Here we go again. You understand? Okay, so for now, we'll just work on this biceps femoris, because it's part of the hamstrings, and I'm going to go back to my front anterior thigh muscles, correct? Okay, and then my hip muscles would be this tensor muscle here, and this is the fascia, and it's lata, so tensor fascia lata. Okay, this is the fascia of the tensor fascia lata, is covering this muscle underneath the vastus lateralis, which is the second of the. Thank you so much, Meg. Yeah, you see what I'm saying? You see what I'm saying? Because once you learn it right now, guess what? When you go home, you don't have to learn it again. You already got it. That's why I was saying, if you come here, you pay attention, and you do this, you're gonna do well in the exam. You understand? It works. It's like it's very simple. In this course of mine, if you put in the work, you get the result. There's no tricks. It's really that simple. If you put in the work, you get the results. It shows. Exactly how you're doing is exactly how you will get. You reap what you sow. That's what That's what Jesus said. It's true though. You reap what you sow. That's what happens. So if you give out good things to the earth, you get good things back. If you give out bad things, you get bad things back. It's fair like that. I think it's fair. Don't you think so? So if you put in the work, you get the result. You see what I'm saying? And I try to give you as many tools as possible so you can succeed. You know what I'm saying? Oh, look at here. I'm tearing my muscle. So you can succeed. So this is where I was saying the sartorius, you see it's covering this, which is the rectus femoris, rectus femoris. So what I want to do is go underneath this, what you call it, the fascia, for the tensor fascia lata. I go underneath it a little bit, and then what I'm going to do right now is go here, and then go here, bing, bang, bing, bang, bing, bang, bing. Okay, and then I'm going to do that. You see, there's my rectus femoris right here. Okay, and then I'm going to go here. So I might as well go do my, because the, do you see how I'm peeling off this connective tissue? And it is revealing our muscles nicely. So this is one of the other muscles we're going to cut in the middle. So I'm going to cut the sartorius here so that I can peel it off of the, the rectus femoris over there. So I don't want to work more on the rectus femoris before I do that. So that's why I'm coming over here and I'm going to do this. You see, I'm going to work on that edge, so I'm going to do this. And we want to make sure we preserve our blood vessels. You see what I'm saying? This is the, this is, of course, is the femoral artery and vein, okay, over here. And then this is the saphenous artery and vein. The popliteal artery and vein goes here. You're going to see it when I do that, because we're going to do these blood vessels will be in your exam, the circulatory system at the end. Okay, so it doesn't hurt if you know them right now, because when we get to it, you already know it. You'll be like, you're just telling me, old news. You see what I'm saying? So I'm going to do that, and here you've got to be a little careful, like I say, because you could, my thing is on, and I made sure I charged it, you know what I'm saying? I made sure I really charged it so that, it's not going to creep out on me. So make sure you don't cut these blood vessels. If I have to peel off the connective tissue from the blood vessels, okay, and then I do that, I put it inside here like this. So I think what I'll do is go up here. I'm going to peel the connective tissue off of here. You see how it's going straight up here? You see how it's going up here? I think I'm going to come here and get that and then come back here, because I can see it, I'm a bit snookered here where I started with my blood vessel. You see what I'm saying? So I'm going to pick on this connective tissue, pick on that connective tissue, and then you see once I do that, I can do this, and then I'm able to see more clearly, and then I can, you know what I'm saying? Then I can cut, and then by the time I get to the other side, I know where I'm at. You know what I'm saying? Do you see what I'm saying? So that's the kind of reasoning you do, And if you are happen to be the surgeon working on a particular patient, don't expect every muscle or everything to be arranged the exact same way. That patient may be different. So whatever you see as you are working with it is how you will respond properly like that with what you see. Don't say, in the anatomy it was like this, like that, because roughly some of the things we show you here, 70% of the humans are like that. Some of them will have a different configuration. So, and that will be surprise, right? So you have to be thinking, you have to be expecting that. So is what I'm telling you. Don't expect it to be exactly, the same way all the time. So when you're working with that particular human, that will be that human. Because the same surgery in one patient is not going to be the exact same surgery again in another patient for that reason. And you should expect it. You shouldn't be surprised. You should be like waiting for it. Like, oh, okay, I got you. See what I'm saying? And the patient leaves. You see what I'm saying, my good friends? So that's how that is. Okay, so here I got snookered with my blood vessel here, but I'm not sure how I'm going to do this because it's running right on the line. Okay. You see how the muscle is like running right here? got it. He got me there. You know, another thing, you got to be able to perform when you're working. Don't be distracted real easy because you kill somebody. You see what I'm saying? Because you'll be trying to do CPR via the paramedic or something, and somebody comes and does something, and you're trying to work. So you can't be distracted. You gotta focus on your game. You see what I'm saying? So thank you for that. Because you know, peer pressure is something. You know, because you guys, you dare each other to do stuff, and then you do it, even if it's stupid. Don't do that. You know what I'm saying? Yeah. Don't be dared to do stupid things. You see what I'm saying? Because if you see some of these TikTok things, you know, or slap a teacher or slap somebody and then run away. Don't do that. You know what I mean? My good friend, I managed to escape. My good friend, I didn't cut it. I managed to escape as I cut it. Yeah, my good friend one, I was like, okay, I'm gonna see what he's gonna do. You know what I'm saying? Because I think that's what you guys do when you're working on your cat. You see something is in your way, and you're like, to hell with it, I'm just gonna go ahead. That's what you guys do. And then you don't get a good score. You see what I'm saying? That's what happens. Yeah, just cut it out. It was like, I just do it. You know, it's gonna be so much easier if I cut this. Sometimes, you know, you just have to be patient. Because here, there's gonna be the there's going to be a whole bunch of muscles here, and of course this is going down here. This so again, remember, you've got to leave these blood vessels intact, and then you could see here is the proximal femoral artery and vein going down here, and then the femoral artery and vein keep going, and then it splits into the popliteal, which is going to go underneath here. It's going to go underneath there. Do you see it going over here to the knee that pops? And then this is the saphenous artery and vein. And this, like I say, will be coming in your lab exam, in your circulatory system exam.